John. He is 8 years old. He is very active and healthy child. Wants to have sleepovers like his other friends, and he is becoming increasingly embarrassed that he has to turn down frequent offers by his friends to spend the night. The reason is he still has bedwetting at night. He was worried so much that he kept himself away from friends. His parents take him for a medical consultation. Other medical conditions was absent and he was diagnosed with a type of elimination disorder. Elimination disorder involve the inappropriate elimination of urine or feces and are diagnosed during childhood and adolescence. Elimination disorders are frequently characterized by a lack of bowel or bladder control. This means children may urinate or defecate on their beds or clothing without intending to. Let's look into the details. Types. Types of elimination disorder diagnosis include ENURESIS, commonly known as bedwetting. ENURESIS is involuntary urination after the age when a person should be able to control his or her bladder. Specific types of enuresis include nocturnal, only bedwetting that occurs during nighttime sleep. Diurnal, only enuresis that occurs during waking hours. And a combination of nocturnal and diurnal enuresis. Then comes encopresis, sometimes called fecal incontinence or soiling, is the repeated passing of stool, usually involuntary, into clothing or other places. Constipation-related encopresis. In this case, constipation causes stool to be hard and painful to pass. The strain caused by the feces can weaken colon nerves. This can cause liquid or softer stool to leak around. Then, non-retentive fecal incontinence. This occurs when a child soils their clothing or other inappropriate items without signs of constipation. Other specified elimination disorder is given when symptoms of an elimination disorder cause significant distress or impairment in social, occupational, or other important areas of functioning, but the symptoms do not meet the full criteria for any specific disorder, such as enuresis or encopresis. Symptoms of encopresis: loss of appetite, abdominal pain, loose or watery stools, scratching or rubbing the anal area due to irritation from watery stools, decreased interest in physical activity, withdrawal from friends and family, secretive behavior associated with bowel movements. Symptoms of enuresis: repeated bedwetting, wetting in the clothes, wetting at least twice a week for approximately 3 months. The repeated bedwetting despite toilet training is known as primary enuresis, and bedwetting after at least 6 months of dryness is known as secondary enuresis. And it is considered bedwetting if it is frequent for at least 2 weeks over 3 consecutive months. Causes: biological or genetic. Specific bladder conditions or medical conditions like neurogenic bladder or untreated diabetes can impact urinary continence. Spina bifida and chronic diarrhea can lead to fecal incontinence. There also appear to be a heritability factor in enuresis, with children being anywhere from 3 to 10 times higher risk for developing enuresis if their parents experienced enuresis themselves in childhood. Then environmental or psychological causes. Ineffective toilet training procedure or toilet training procedure that occurs later than necessary may contribute to enuresis and encopresis. Moreover, higher levels of stress may also impact this disorder. Additionally, if a child experiences chronic constipation and experiences painful bowel movements, they may become extremely fearful of defecating and as such avoid doing so. This perpetuates concern with encopresis. Thus, they may avoid defecating for so long until they physically can no longer do so, and it results in accidents. Diagnosis. First, the doctor will take a medical history and perform a physical exam to rule out any medical disorder that may be causing the release of urine, which is called incontinence. Lab tests may also be performed, such as a urine analysis and blood work to measure blood sugar, hormones, and kidney function. Physical conditions that could result in incontinence include diabetes, an infection, or a functional or structural defect causing a blockage in the urinary tract. Enuresis may also be associated with certain medicines that can cause confusion or changes in behavior as a side effect. If no physical cause is found, the doctor will base a diagnosis of enuresis on the child's symptoms and current behaviors. Differential diagnosis. Elimination of other reasonable possibilities is a major component in diagnosing an elimination disorder. Screening tools and assessments. Nocturnal enuresis clinical management tool and direct observation and interview for encopresis is used as diagnosis for this disorder. Management. Enuresis treatment. Bell and pad method. This requires a child to wear a device to sleep. This device contains a sensor that makes a noise when wet to stimulate the child to wake up. The bell and pad method intends to stop the stream, allowing urine to be passed in the toilet instead. Dry bed training. This is another option which combines the bell and pad with behavior treatment for the child with parental support. Limiting fluid intake. Children prone to bedwetting can be assisted by restricting their fluid intake before bedtime. Bladder training. Under this technique, children are taught to hold their urine for longer periods of time. This is useful for diurnal or nocturnal enuresis. Encopresis treatment. To manage this condition, a pediatrician may give the affected child a laxative or enema or medication to soften the stool. To avoid constipation, parents can encourage a healthy diet high in fiber. Children should also drink more water to alleviate constipation. Improved potty training. Here the aim is to train the child to learn to control his sphincters correctly. The child uses resources such as breathing techniques, contraction, relaxation of muscles, etc. The reward for progress takes place with rewards to reinforce behavior. Motivational therapy. The child and their caregivers may receive this therapy to boost morale before beginning any of the methods listed above. Hope you like this video about elimination disorder. Please subscribe the channel for more videos on related contents. Thank you and keep smiling.